We're gonna dive in, and I'm going to also give an opportunity for the audience to ask questions later. So start thinking of some maybe difficult questions. But I'm gonna start with a difficult question. Why do clinicians need to learn data science? Like, if I'm just interested in seeing patients, do I really need to know anything about artificial intelligence? And if so, why?
I guess I'll start that one off. I think the reason that, and only it's partially from my own experience, is that it's important. Our world is changing as clinicians. Data is a data-driven world, and working in clinics where we have electronic medical records, a lot of our world is about data, and data will be the engine of developing new healthcare interventions, ways we care for our patients. And we have to understand the roots. Like, where does it come from? How is it generated? How can it be helpful? And more importantly than ever, we need to have a seat at the table as the new technologies develop, like the generative AI, and knowing that all the potential harms it's going to be a part of our life, and we've got to be able to manage that.
I think it's an interesting question because currently there's really a wide range of how physicians view data science. There's on one side of the equation, or one side of the curve, there's people that are really not even interested in it. And on the other end, there's people that have dual degrees in healthcare and data science. I think going forward, if you're forward-looking in your career, and if you don't know data science, you're going to just be swept along, and you'll be at a disadvantage, to be honest with you. So I think that for that reason alone, you should probably try to at least have a little bit of familiarity with it. But the real reason to me is that physicians should be involved in data science because it's an amazing opportunity. When I look and see what's happening with the people that are working in this conference and what they're doing to affect healthcare, it's inspiring. It's a great opportunity.
All right, for me, actually the main reason that I think clinicians might want to do data science because you guys have data and you guys understand the data, right? And we can do a lot of things with those data. For example, from my understanding, you can find, if you have a lot of data, you might be able to find the root cause of it, or you might be able to find something or discover something that is hidden in the data, and make use of it to, make a new cure method, or find new causes of the disease or something like that. But the data that you guys have and then are holding are really valuable. So you should try to dig into the data, right?
For my opinion, if the clinician know the basic of data science, they can use data driven for decision making, and they may find many opportunity for research when they know any technique for data science. And they can see we see the data every day, but we have new technology from data science make a new research. And for the hospital leadership, if you have a basic data science skill, you can make a good decision based on the data.
So just one last comment. Even if you're a physician and you have some involvement in data science, you can help frame what the problems are. So you can identify the pain points, you can identify where AI can make a difference in terms of identifying the problem and helping the data scientists know where to look and what to do. The other end of that equation is physicians need to be involved in the implementation of what the data scientists create. And if you don't have a say there, It's a big mess. You need to inform the data scientists what your workflow is like, what your situation is, so that they can design it for you and make your life better rather than just some person typing on a computer coming up with a cool algorithm that doesn't work at all in your setting.
So I'm gonna try to summarize the main points. It sounds like you don't need to be interested in research, because people think that, people who are in the field of machine learning are only people who wants to publish. It sounds like you will be left behind if you don't understand data science. The world is changing, and one of my favorite saying is that if you don't have a seat at the table, you're probably on the menu. Someone is taking advantage of you. And then the other message which I got from Korn Chawal is that as a clinician, you have an obligation. You need to be there so that we will really harness the benefit of data science and big data. It's almost like this is part of your job. It's not just taking care of patients, but also trying to understand what is the best treatment for your patient. And you need to be part of that. So the next question I'm going to ask Korn Chawal first. If it were up to you, what do you think should clinicians understand about data science that would be most helpful?
Okay, so first, data science have like its own process, right? As like we all know, we have like a data collection. We have to prepare and clean the data. We have to do like exploratory like of the data, and then we analyze it, and then we interpret the thing like the model or the result that we got from like machine learning or statistic or those kind of thing. First off, like this process, clinicians or whoever like wants to do like data science like needs to understand that there are like a lot of stages that you have to go through. It doesn't mean that you got the data, you plug into the model, and then it will just come out for you. It doesn't just go like that. Right, so there, like, it involves like a lot of process there, and to first, we need to understand the process, right? Second, at least like in my opinion, whoever like wants to do data science, okay, although they don't really need to know like all the codings and then everything, but at least you guys might need to know how things work, at least like for in like a concept level, to understand what the data scientists are doing with your data, and then how you would interpret the result that you got like out from the model, right? Incorporating with the knowledge that you have, because like you guys are like a domain experts, right? So at least you need to understand the concept of like, for example, machine learning algorithms. I mean, like I don't mean that you need to understand like how algorithm works and like everything, right? But then at least like in the high level, and so that you can choose the model or the categories of the models that are going to work with your data, and then the purposes of your working like with the data. So that's kind of like at least two basic things that you need to understand the process and the concept of like how algorithms like works in that, right?
Now let's ask the clinicians. What do you think should clinicians know about data science? Do they need, and I get asked this question all the time, do I need to learn R? Do I need to learn Python? Do I need to learn SQL? Let's see what your answer would be.
I think before we go to the modeling of the model, if we know the process of data visualization and data exploration, imputation, and you may understand the research, or when you talk to the data scientist or biostatic person, you will understand and get the right thing to ask them what they should do. If you don't understand this process, you can ask anything to them and get the right answer. And I think for the coding, it's just a language, just in Thai, in English. If you know the core of coding, you can do any language or R or Python. And nowadays I use some ChatGPT to help me to run a Python code and adjust by myself to improve the coding. I think you don't need to code by yourself, but you at least to understand the basic.
So I just want to agree with your point of saying that one of the things that clinicians need to do is one of the first things that you can do, if you can't do anything else, you can meet a data scientist and talk to them and start to learn about it. And it's the starting of those collaborations where the knowledge will start to grow and flow between the two parties.
I agree with that. I think at a minimum, the physicians should be able to communicate with the data scientists. Communication occurs on many different levels. It can be very high level and conceptual and just describing, even very high level things. Or for those that are motivated, communicate on a very deep, intimate level where you are doing coding and R and all these sorts of things. Vast majority of physicians are never going to do that in terms of deep coding and all that. But if you can have a conversation with a data scientist and you can understand each other, that's what you really need. They need to understand our issues, we need to understand their issues, and together a solution that will arise will meet many people's needs and be more effective.
I just want to add to that a little bit. So when people are saying that, you need to know a little bit of code or you need to know how to code or something like that, don't get panic, okay? It's not that bad. The thing is that for the coding, what the skills that you need to have are going to be the logical thinking, which in your profession, you guys have already have it, because you have to get information from patients and then make reasonings and then logical of what happened and then how to cure people, how to diagnose disease for people, right? You have already processed those skills, those logical skills. But for coding, it just means that you just need another tool, which is computer language. And then you kind of find a way to incorporate all of the commands to get the result that you want. So there is a movement actually for now that they kind of encourage young generation to code, right? So there is a website called code.org that they kind of encourage kids, children to code when they since they were young. Or so I'm gonna say that essentially everybody can code, so just don't get intimidated by the word, you have to code, or you have to be able to program, something like that, because I'm sure you guys will be able to do it.
One quick comment is, if you're a data scientist, the flip side of that equation is we kind of want you to talk to us a little bit too, so that you understand our world. We need to understand what the data scientists do and how they do it, and how we might be able to collaborate. But it's a two-way street. We need them to come to our, it actually is worth coming to the clinic, walk through it, see what we do, and see how it works. And once people understand each other, it starts to grow.
So it looks like one of the universal theme that we're getting is that to advance data science, you need close collaboration between data scientists and clinicians. That's all very easy to say, but it doesn't happen. So can people elaborate on the challenges of getting the clinicians and the computer scientists to work together?
I think it's really difficult because we interest in not the same thing. The clinician want to do this research, but engineer want to do another research. I think to make it happen, you make to set a common goal and make a community with us, with a clinician and engineering, and do a lot of communication to build this project. And feel the ownership of our project, not my project. It can make it happen.
I think one of the biggest barriers, a couple of different barriers that I would call out is, first of all, time, right? It's not the first, most of us are trained, hired. Our role is to take care of patients, and that's how we see ourselves, and that's how our jobs are formed. So how do we get the time? And I think that's a higher level question for people who are looking at structuring physician jobs or education. All these things it's just like research. Physicians may want to do it, but they just don't have the time. The second sort of pulls in from the last question a little bit is a common shared vocabulary. So the communication sometimes feels a little challenging because I don't know what they are talking about. It's like these words don't make sense to me, or they're words that I have a different meaning for. Like, take data harmonization. I was like, I have to really think about what does that mean to a data scientist versus me. So there's a whole vocabulary here that is probably an easy thing for us to learn. It's going to be easier than coding anyway. That needs to be broken down. And I'm going to guess that they will have that same barrier when I start using all my clinical lingo.
In preparing for this panel, I was looking at the literature a little bit about the issues of physicians and data scientists, the difficulties that arise trying to get the two teams together, so to speak. And some have been mentioned already, time being one of them. But they also mentioned this idea of culture. The data scientists have a certain world they work in, and they have a certain way of doing their jobs, and physicians have a different way of doing that. And physicians are it's very hierarchical in medicine. The professors and the junior faculty, and whereas data science has a different way of organizing their lives. Some of it is even physical. The Department of Computer Science is here, the hospital or the Faculty of Medicine is here. They kind of never see each other. You have to actually walk someplace or drive someplace to see them. So it requires an active outreach. So there's a lot of reasons why there's not a lot of crosstalk between physicians and data scientists. It's one of the great gifts Leo has done for me anyway, and for a lot of people, is invited physicians into his world. Not a lot of people doing that, but I think we're seeing how valuable that is to do. So these barriers are there, but they can be surmounted if you're persistent and you have a little bit of a friendly smile and you want to go out and reach out and touch people. You'll be surprised. Each side needs each other. Both sides kind of do want to meet. It's like two single people. They're kind of hoping they find another person they like to work with.
I agree with what Katie have said about the time. We need time to understand each other. Actually, I experienced this firsthand in the past 2 days, because I was part of the mentoring group for the hackathon, the datathon students, right? And the thing is that if we don't know the meaning of different values in the data, we as a computer scientist, we wouldn't be able to go on anyway. So we have to stop and can kind of take time to understand what does it mean by the heart rate, how you usually measure it, what's the possible values or something like that, so that we can kind of work really work with the data and then have a meaningful result, right? And then I find that even if we have a limitation in times or the time pressure or something like that, we just need to stop and then talk, and then so that we can continue going on. So yeah, we have to come together and then take times to understand what each others are doing, right?
So let's pretend that we have a magic wand and suddenly we give everyone time. Do you think that will solve the problem? So what are the cultural challenges? And I think we've heard a little bit about clinician challenges to working with data scientists. We'd like to hear about data scientist challenges in working with clinicians.
Again, from the past 2 days, I guess it's the terms in the health science that we might not understand, and then probably some of what I have experienced is that the way they kind of represent data that I have never seen before. So the doctor in my group talk about like some, like hazard ratio or something like that, but I don't understand like how can I represent it? I wouldn't be able to go on, so I just need to have the open mind and then just talk to the doctor, like what exactly, do you want, what this value is coming from, and then like how are you gonna represent it, or what exactly do you want to say, or like what the message of the graph that you want to tell the audience or something like that. So I guess from our perspective, we really need like the domain expert information for us to work on these data. Otherwise, it's just gonna be numbers, and then we don't know how are we gonna how are we gonna interpret it? We still don't know, right? So that's the thing.
Any other addition in terms of cultural challenges for clinicians to be able to work with data scientists?
I think probably the main ones were, just how maybe it's just we need to develop our common language a little bit, and just spend time together, I think is another thing, to just get to know how you think versus me. I was just listening to you talk, and I thought, I need to put myself in her shoes. I need to sort of think about what it's like to have no medical knowledge. I mean, that's like a real stretch for me, right? I just, it's so ingrained that I can't really be as helpful as I can be if I were to sort of try to put that all aside and pretend I don't know any medicine.
I think you just have to, it's one of those situations you just have to you have to put energy into it and interact with people in any way that you can. If there's a conference, if there's a lecture, even if it's just in a casual social setting, somehow you interact. I have personally tried to make this journey from being a physician only to a physician data scientist. And I've taken every opportunity that I can to try to connect with the data scientist and develop a relationship and have a conversation and try to build a collaboration and see if their interests match mine. And if not, I move on. If they have an interest, I'm happy.
I think we can try to connect with a data scientist or engineer, make a new collaboration, may make the cultural of both sides can do work together. If we had a data camp or hackathon like this, make to work with together. Make me feel more comfortable to work with it.
So I think we're preaching to the choir here. The people who are here are the ones who are interested in learning more about the application of data science in healthcare. But the average clinician is not. They're overworked, and somehow they need to see some value. So how will you convince your clinicians, your fellow clinicians who are not convinced that they need to learn data science? If you are given 3 minutes to pitch, what's in it for them? What's the value that they would get from being involved in this if they're not interested in research, they're not interested in publications, they're not interested in being promoted? All they want to do is to be able to do what they love doing, which is taking care of patients. So what are some of the ways to advertise this to your friends who couldn't care less about artificial intelligence?
Well, from my viewpoint, or from my perspective, as a internist working in a primary care clinic, I will tell you that this is the best thing on the horizon to address physician burnout and make your life better. Now, that's not going to happen overnight, But if we can start to leverage these technologies, maybe that's not, doing diagnosis, but if we can have things that help us, communicate more efficiently with our patients by using chat programs or algorithms to screen out the messages we need to know or not need to know. Can a chat GPT search my medical record for me and come up with all the visits that were related to I can go down a whole list of stuff. And, but in order to that to happen, at least someone has to put some time in with it from the clinical standpoint. So even if I don't want to do it, I should get behind the institutional or multi-institutional efforts that need to happen to realize the benefits that are on the horizon.
I'm guessing that we're never going to get even a majority of physicians that are interested in doing this. I think if you have 4 kids and your both spouses are working and the parents are sick and you've got mortgages and cars to pay for and all these things, you're like, oh my God, to pick up an AI project on top of that, it's hard to do. But the door should be open for them. They should know that we're here. And there's great opportunity. It's one of the most enjoyable parts of my life, even when I was working full-time in ophthalmology. It's a great thing. It's kind of fun. It's really interesting. You can make the world better. You can make your own world better. And so all the positives are there. I would be sort of like other things that are generally good for people that they don't take part in because, whether it's a healthy diet or, whatever. Not everyone's going to do it, but we'll take as many as that want to do it and tell them the door's open for people that aren't ready to make the dive.
First off, I think this is a really hard question for us, especially for computer scientists or computer nerds, because we are probably bad at convincing or communicating with people. But then what I'm gonna say is that you have data, and there are things hidden in your data that you cannot normally see with your eyes or in everyday life or something like that. If you can find something really useful in that data, it can change the world. It can change it can not change completely. It might be a small change or something like that, but then it's gonna make your career or your your job, your working with patient, it's gonna improve it. It's gonna be better because it's a thing that you don't really normally see. But then if you kind of dig into the data and then you see those, sometimes you're gonna have oh, that's why, and then you can go on with the next step of the job or the task or something like that. So it's gonna be really helpful to do data science, just to find things that you don't really normally see, just to see the surprises in there. And probably there are a lot of good surprises that can answer a lot of mysteries in the field.
If we want to your colleague to do a data science, you must give that the benefits. If you know data science, such as yesterday I teach my medical student. I told them about the preceptor AI when they do work in the ward. When I ask them what the differential diagnosis of the disease. If you have the idea, such as I am a neurologist, I give you some example, such as the first the dementia symptom with rapidly progressive and fever. You can put it to the computer to give you some idea for the differential diagnosis, and if it makes you treat patient easily or make your work easily, you might love the data science. If I go to in the data science for me, I give some a lot data from the National Health Security Office or Universal Coverage of Thailand. I have one database it have a lot of data in the Thailand. I think it's very easily to make a research by don't need to collect any new data, and I make many research from this data. And I think if you have a basic data science, you can do anything easily. When I go to study in Python, I have a new opportunity for the computer vision. I see, it have a technology like this. I can have a new idea to make my new research if I know that new technology. And before go to the state, I have a new idea such as Parkinson disease related with the fundoscopic finding. I think we have a new opportunity with the data science.